Okay, let's jump right into this deep dive. We've got some really interesting sources here today.
Mhm.
We're focusing on mental health and psychological well-being for Black Americans. It's a pretty complex area.
It really is. And our goal here, looking through this research, these articles you sent, is to kind of pull out the key insights.
Right. Understand that unique mix of culture, history, systemic stuff, how it all shapes the experience.
And one of the first things that really stands out is this kind of paradox, wouldn't you say?
Yeah, it's surprising. You'd almost expect, given everything, just like way higher rates of mental illness reported across the board.
But that's not quite the picture the stats paint, at least not initially. Some figures for, any mental illness in a given year might look similar, maybe even a bit lower compared to white Americans.
But this is the key part from the sources. Black Americans do report higher levels of persistent emotional distress. That seems crucial.
Exactly. And when conditions do show up, they're often more chronic, more persistent, not so much episodic.
So similar rates maybe at the start, but the suffering seems deeper, lasts longer.
That's what the sources suggest. And they really point towards systemic failures after someone starts struggling. Problems with detection, getting the right treatment, getting, ongoing support.
It feels like the system often misses the early signs or just doesn't provide what's needed for real long-term recovery.
And the roots of that, the mistrust, the inequality, the sources trace it way, way back.
Yeah, they talk about how early American psychiatry was actually used to justify slavery. It's quite disturbing.
Absolutely. Things like pathologizing enslaved people who wanted freedom or twisting census data to claim freedom made Black people insane.
Wow.
It created this lasting legacy. Even big names like Benjamin Rush, seen as a founder of psychiatry, pushed some racist medical ideas.
And the sources are clear. This isn't just old history. It directly feeds into suspicion, reluctance to even engage with mental health services today.
Mhm. And that suspicion gets layered on top of the very real present-day impact of systemic racism and trauma.
Right. The sources bring up concepts like race-based traumatic stress.
Yes, and Dr. Joy DeGrew's work on post-traumatic slave syndrome.
These ideas are important because they basically name racism itself as a psychological wound, right? Not just like an outside stressor.
Precisely. And the sources give some stark examples, like police killings of unarmed Black Americans, adding up to over 50 million extra days of poor mental health for Black Americans every single year.
50 million days.
Yeah.
That number is staggering. It just speaks volumes about the constant psychological burden.
It really does. The corrosive effect of living with that persistent injustice.
Okay, so you have this deep history feeding mistrust, plus this ongoing trauma. What about the practical hurdles? What barriers do the sources say stop people getting help, even with that persistent distress?
Well, they're significant and kind of interconnected. Socioeconomic factors are
Or
huge.
poverty, not having good insurance.
Exactly. Black adults living below the poverty line, twice as likely to report serious psychological distress, the sources say, but also much less likely to actually get care.
And then there are cultural elements too.
Yeah, stigma can be really strong within communities sometimes, like a feeling that mental health struggles are a sign of weakness or just wanting to keep things private.
One source mentioned, what was it, 63% of Black individuals surveyed felt that way.
Which can mean people put off getting professional help, maybe until things reach a crisis point. Or they might turn to faith communities first.
And while those communities are vital support
It's
systems,
absolutely vital.
the sources do point out that relying only on them might sometimes delay getting clinical care when it's needed.
Right. And even if someone does reach out for professional help, they might run into provider bias or maybe a lack of cultural understanding.
Or just the struggle to find a therapist who gets it, who shares their background, their lived experience with race.
Yeah, the numbers are pretty telling. Only around 2 to 5% of psychologists are Black. That lack of representation system-wide, it contributes to misdiagnosis, communication breakdowns.
And people may be ending up in emergency rooms instead of getting steady, specialized care.
Exactly. It's a whole web of barriers.
Yet, despite all these massive challenges, the sources also really highlight the incredible resilience within Black communities.
Oh, definitely. They really emphasize the strength drawn from spirituality, from, strong family ties, those extensive kinship networks, deep cultural pride, too.
Institutions like the Black Church, even with that paradox we mentioned about sometimes delaying clinical help.
Are still incredibly important sources of support and trust.
And community-led efforts too, right?
Mm.
Creating those culturally affirming spaces and services that kind of bypass some of the usual system barriers.
Yes, those are highlighted as crucial.
Okay, so let's try and wrap up this deep dive. We've touched on how this painful history fuels today's mistrust,
Mm-hmm.
the serious, measurable psychological weight of ongoing racism,
Right, those 50 million days.
the major linked barriers to getting care,
Socioeconomic, cultural, systemic.
and also the powerful resilience found within Black communities and culture.
It's a really complex tapestry.
And understanding all this, it isn't just about individual stories, is it? The sources hammer home that these are systemic problems affecting a huge population. They need broad societal solutions.
Yeah, achieving mental health equity means, well, it means tackling those systemic barriers and supporting culturally relevant ways of healing.
Which kind of leaves us, and you, the listener, with a final thought to mull over.
Given everything we've discussed, the documented history of harm within mental health care itself, and all the barriers Black Americans still face.
How can real trust actually be rebuilt in these systems? And what does genuine healing even look like when it has to constantly contend with ongoing injustice?